Welcome, everyone. I think we're ready to start, and we're glad that you're here today. And my name is Craig Brown. I serve as the Executive Director of Congregational Development for our annual conference, and am engaged in working with our communications department led by Selby Ewing and also served by Tui Yang in presenting our Wednesday webinars. And we've been doing this for about a month now, and so we've learned a tremendous amount about how to move these webinars forward, and we're continuing to learn. So we want to thank you for being with us today, being a part of this process as we learn as an annual conference how to do a greater deal of distance learning together. We're trying to have a good variety of topics we're covering on a weekly basis, kind of shifting sometimes from more program and ministry issues that we're facing in the area of sheltering in place with COVID-19 to more kind of administrative issues that we face in the local church. So as we move back and forth between these topics, we hope that this kind of cycle is helpful to you and is really kind of speaking into the world in which we all find ourselves currently. So as we look forward to the coming webinars that'll be happening throughout the month of May and then into early June as we have them planned, and hopefully even continuing afterwards, always open to hearing from you about what you might like to see in the webinars. Every week we try to communicate by sending an email afterwards to get your input and feedback, a little bit of evaluation, and we've been putting together that data, and so it's really helpful to hear from you. So please reach out and connect with us using that evaluation form, or even email me or Selby, our Director of Communications, directly. You can find our email addresses on the conference website at cnumc.org. You'll also notice on the website for the annual conference on the right, there's a button there for Wednesday webinar. If you see that button right beneath the bishop's message, if you click on that, that'll take you to a library of all of our Wednesday webinars, and you can find there all of them that have been recorded, which all of them have been. I will let you know that we're going to keep those recordings there for as long as we possibly can. There is one exception, however. You might remember the very first Wednesday webinar we had with Jason Moore about developing online worship. Part of our agreement with Jason in presenting that is that we would leave that webinar on our website for 1 month. And so that 1 month is quickly arriving. And so if you would like to take a look at that content about online worship, I'd encourage you to do that as quickly as possible, because we're probably going to be taking that content down by next week. So try to get to that if you can, simply by clicking that Wednesday webinar link on the right side of the webpage so you can catch up on some of the topics we've already been covering. Today, we're going to turn our attention to some of those administrative functions, some of the realities we're facing in the midst of the pandemic and how it affects us in a variety of different ways. And we're focusing especially today on kind of pensions, health benefits, and things of that sort that really don't just affect clergy, they also affect our churches as well, because our churches are the primary partners in contributing to those things as part of compensation packages and other ways it impacts us as a whole church. So we wanted to invite the expert, the person who in our annual conference really has a mastery over so many of these details. And he's been a great resource to this annual conference over the years. And the different hats that Paul Ekstrom Fernandez has worn, he has brought a degree of professionalism and expertise and background to everything that he's engaged in. And now as our chief benefits officer and pensions officer, he really now brings that expertise to us in that way. So we're thankful that Paul is going to be leading us today as part of the Wednesday webinar. So I'd like you to stop for just a moment, give Paul some virtual applause over in the chat, give him some props for the good work that he does. And Paul, we're glad that you're with us. I'm going to turn things over to you, and thank you for being with us and serving our annual conference.
Hey, thank you, Craig. I really appreciate the introduction. It's good to be with all of you today, and on behalf of the Board of Pensions and my staff colleagues, Andrea Winchester, Brian Grimmer, and David Bennett, we'd like to extend our prayers and thoughts to you during this really unprecedented time in our lives. We're primarily working remotely, but you can reach us by phone at our, let me see one thing here. There we go. Sorry about that. You can reach us by phone at our main number, 916-913-1049, or by email. Today, thank you, we'll be covering 5 areas of interest with you. First, I'll be providing you with an overview of the pension programs of the United Methodist Church. Second, we'll look at some of the examples of pension plan distributions as a result of current stock market activity and volatility. Third, I'm going to share some thoughts on things you might consider doing as a response. Fourth, we'll preview upcoming legislative changes to the UMC's pension plan at General Conference, namely the Compass Plan. Fifth, I'll review our current health insurance plans and the potential impact of COVID-19 on our 2021 renewals. Before we begin, I do offer this disclaimer. My purpose today is to share with you general information about our pension and healthcare plans. You'll see some big numbers and some small numbers, and you'll see some charts. The charts are not necessarily proportionally accurate, nor are the numbers from any specific individual or account data. However, the information is reflective of real-world situations. Nothing should be construed as specific financial advice. Every person's financial situation is unique. If you are enrolled in one of our pension plans, you have access to free financial services through EY. I'll speak to their services later in the webinar. And as always, you can contact me at our main number anytime to review your pension statement or discuss any other pension or benefit matter. We'll also be posting relevant phone numbers and website links at the end of this webinar. One of the best tools available to review your United Methodist pension plan is available through Benefits Access. On the website of westpath.org homepage, you can find a login link to Benefits Access. All participants who are enrolled in one of our retirement plans can access their accounts through this portal. If you haven't signed up for Access, you can do so by answering a few questions and verifying your identity in the online registration process. It's absolutely mandatory to be logged into Benefits Access in order to turn on your retirement benefits. Once you've logged into Benefits Access, you'll land on its introductory page. There are several options available to choose from, but today we'll be focusing on the tab labeled My Benefits. On the My Benefits page, you'll see 3 gray boxes with the titles Personal Profile, Retirement Benefits, and Project Future Values. Clicking on the Retirement Benefits selection menu will enable a drop-down menu with several choices. I'm selecting Summary. So I'm going to introduce you to somebody, and this is the page, the summary page for Reverend Amy About To, as in about to retire. Immediately, you can see several things about Reverend Amy's retirement accounts. First, you can see that she has 5 different retirement accounts. 3 of these are pension plans, and 2 are retirement savings accounts. 2 of the pension plans are legacy plans, which means that no new employer contributions are being deposited into their accounts. Second, you'll notice that the accounts are categorized in 2 different areas: a plan balances category and a monthly defined benefit category. Additionally, you'll see a summary of Reverend Amy's investment allocations under the pie chart. What you don't see on this page is Reverend Amy's age. She's 63. She has almost 40 years of service as a United Methodist clergy person. She's worked full-time throughout her career, and she's married. One of the legacy pension plans is known as the pre-1982 plan. It's number 5 on that summary page. You may recall that at each annual conference session, we take a vote setting the past service rate for retirees receiving a pre-1982 benefit. Retirement distributions from this plan are calculated based on the number of pre-82 years of service a clergy member has times the past service rate. In 2020, the rate was set at $903 per year of service. Reverend Amy has 2.5 years of credited pre-1982 service and would receive $2,258 a year, or $188 a month, if she were to retire this year. Currently, we have 387 members receiving a benefit from this pension plan, and another 31 future participants that will receive a distribution from the plan. The second legacy plan, number 1 on the summary page, is the Ministerial Pension Plan, or MPP for short. MPP was active from January 1st, 1982 through December 31st, 2006. Its construction is unique in that it acts like a defined contribution account during its accumulation phase and is mostly converted to a defined benefit plan during its distribution phase. What does that mean? Well, in the case of Reverend Amy, she has a balance of $540,000. If she were to retire today and turn on her MPP benefit, exactly 65% of the $540,000, $351,000 in this case, would be converted to a guaranteed life annuity, and then would be considered a monthly defined benefit at that point in time. The other 35%, or $189,000, would remain in the plan balances category and is added to her defined contribution account balance. We currently have 570 participants receiving a benefit from this plan and another 307 future annuitants. The current pension plan is known as the Clergy Retirement Security Plan, or Program, or CRSP for short. It has 2 parts to it: a defined benefit part, or CRSP-DB, and that's noted on the bottom of the page, number 4 on the summary, and a defined contribution part, or CRSP-DC, which is number 2 on the summary page. The defined benefit part is a guaranteed annuity based on a formula. For service from January 1st, 2007 to December 31st, 2013, the formula is based on CRSP years of service times the denominational average compensation on the date of retirement times 1.25%. On the summary page, you can see that Reverend Amy's monthly benefit, if she were to retire today, would be $530 a month for 2007 to 2013 service. In fact, all clergy who have the same years of CRSP service would receive the same retirement annuity benefit if they all retired on the same day. By action of General Conference, effective January 1st, 2014, the pension annuity formula was changed to lower the benefit in the following way: CRSP years of service times the denominational average compensation on the date of retirement times 1%, not 1.25%. This formula change only applies to credited service earned after January 1st, 2014. In Reverend Amy's case, she would receive $343 a month if she retired today. You'll notice on the screen that it shows that there's a reduced amount, and that's because Beginning with 2014, General Conference also adopted a reduction for married clergy with this particular plan. Reverend Amy also has 2 additional retirement accounts. The first account is part of the CRSP plan, as I mentioned earlier, and is the defined contribution portion of the program. Number 2 on the summary page. Reverend Amy has a balance of $25,000 in that account. Every church enrolled in CRSP is billed 3% of the pastor's plan compensation to determine this monthly amount. However, every pastor enrolled in CRSP must make at least a 1% contribution to their United Methodist Personal Investment Plan, or UMPIP account, in order to receive the full 3% from their church. It's basically a 2% to 1% match. So what is plan compensation? Well, it's made up of 3 things: cash salary, utilities, and housing allowance. If a clergy person is living in a parsonage, the cash salary and utilities allowance are added and multiplied by 25% to determine the housing allowance value. The second retirement account is the United Methodist Personal Investment Plan. It's number 3 on the summary page. Reverend Amy has a balance of $100,000 in this account. This is an optional plan for all clergy, and it's also available for lay employees. For clergy who enrolled in UMPIP, their local church is sent a bill by Westpath for a monthly contribution deducted from the pastor's paycheck. As I just mentioned, pastors who contribute at least 1% to UMPIP will have a full 3% church contribution made to their defined contribution account. If they do not contribute to UMPIP, they would only have a 2% church contribution made to their defined contribution account. Pastors can certainly make a larger contribution to UMPIP beyond 1%, up to the legal limits set by the Internal Revenue Service. Those numbers change on an annual basis. So in addition to retirement accounts, you can also see the investment mix that applies to the accounts under plan balances. Most participants use Westpath's LifeStage service to manage their investment accounts. And you can find that page by clicking the LifeStage tab at the top. LifeStage works for you by adjusting your investment mix based on 3 factors: your age, your expected date of retirement, and your risk tolerance level. The older you get and the closer you get to retirement, the less exposure you will have to riskier investments, even if you've selected an aggressive risk tolerance profile. Since Reverend Amy's age is 63 and has selected a moderate risk tolerance level, her plan balance accounts have 44% invested in equity funds and 56% invested in fixed income funds. The security that LifeStage provides in managing your investment account is an important factor in navigating stormy and unpredictable financial markets. So, Reverend Amy has been thinking about retiring soon, but the coronavirus pandemic has her wondering what she could expect in monthly distributions from her retirement accounts. She knows the stock market has dropped significantly since the beginning of the year. So what does that mean for her? Now, the short answer is it depends. It depends on her projected date of retirement and the value of her investment accounts at the time of her retirement. It's basically a function of the time value of money. The longer you invest, the more money you will have when you retire. WesPath provides a great tool for a quick look at your retirement income. On the My Benefits webpage, you can click on the Project Future Values drop-down menu and select the Retirement Readiness tool. Many retirement experts suggest that 85% of your current income is a reasonable goal for retirement living. Remember, when you retire, you're no longer going to be paying Social Security taxes, nor will you be paying into your retirement accounts. Instead, you'll be drawing income from those same accounts. The actual amount you need at retirement will depend on a number of factors. Where you live, will you downsize or upsize? What's the cost of your health insurance? Are you planning to travel extensively? And so on. All of those determine your cost during this phase of life. Long-term care, retirement living in a home, all of those will add cost down the road. So there are two screens that are available with this tool. If we click on what says, take a look at your numbers, you'll see the first screen. So you can see slide bars that let you adjust your cost estimates for housing, medical care, and discretionary spending. Those adjustments potentially change your retirement goal. The first screen shows Reverend Amy's annual plan compensation of $75,237. Well, why did I pick that number? Well, in Reverend Amy's scenario, that's actually the conference average compensation for 2020. It includes, again, cash salary, utilities, and housing in its calculation. The screen also shows two bar charts. Each of the colors on the charts represents a different retirement account and the income associated with that account. So Reverend Amy isn't thinking of retiring this year, but if she did, this screen is showing a retirement goal of $5,329 a month. It also shows that if the stock market continues to perform poorly between now and June 30th, her income would be about $4,749. By the way, all of these income estimates include Social Security distributions. Now, had markets performed as expected, she might have received $4,936 a month. It's a difference of $187 a month, or $2,244 a year, about a 4% differential. While that is not an insignificant amount of money, it isn't as catastrophic as what many might have imagined. Several of the projections that I have looked at recently show a similar pattern of about a 3 to 5% drop in expected retirement distributions for new retirements this year. Let's put that into context. From its high water mark in February, the stock market has dropped about 18% to today. Because of WesPath's management, utilizing tools like LifeStage, much of the potential instability and volatility of retirement accounts has been mitigated. This is not significantly different than what has happened in prior years when the stock market has performed poorly. So, Reverend Amy is thinking about retiring in the year 2022 at age 65, when she becomes Medicare eligible. The second screen of the retirement readiness tool lets you try out different scenarios. Since Reverend Amy's salary is projected to increase 2% each year, her retirement goal is now $5,658 a month. If market performance is average between now and 2022, Reverend Amy could expect $5,610 a month. Not quite her goal, but remarkably close, within a 1% spread. As you can see on the screen, Reverend Amy could also explore changing her personal contributions, her retirement age, or her risk tolerance level, and see how those might impact her income levels at retirement. However, in the case of Reverend Amy, the single most effective way of increasing her retirement income is by working longer. If I were with you in a room, I would probably have heard a collective sigh of exasperation. Well, what does this have to do with me anyway? If I've got 30 more years till I retire, why should I care? The stock market goes up and down and up and down. Undoubtedly, there will be market turmoil and upheaval in the future. I can ride this out and it won't make much of a difference in the long run. Well, let me introduce you to Reverend Larry Longway, as in a long way from retirement. He's in his early 30s and has about 34 years left until he thinks he wants to retire in the year 2054. Reverend Larry knows he should be putting away money into his retirement account, but he has decided not to make any contributions to UMPIP. He has a lot of reasons for not making contributions. However, the consequences of his decision may lead to a future with difficult choices. Looking at Reverend Larry's readiness assessment screen, what may jump out at you is the projected annual compensation, over $150,000. Believe it or not, that is the projected average compensation in our conference in 2054. Based on that compensation, Reverend Larry's retirement goal is $10,662 a month. Since he decided not to contribute to his MPIP account, his projected monthly amount he will receive at retirement, assuming average investment returns, is $7,949 a month, about 25% short of his goal. And if market returns are poor, he might be looking at a 33% gap. Well, Reverend Larry knows he has time on his side. If he makes some adjustments in his life, he knows he could start making contributions. Let's say he builds up to investing 4% of his planned compensation into his UMPIP account by the year 2023. Why 2023? Well, it fits with my narrative, and it's the projected launch year for a new Compass pension plan for the United Methodist Church, assuming legislation passes at General Conference next year. Also, Reverend Larry's life stage investment allocation mix is quite different from Reverend Amy's investment mix. Reverend Larry has about a 90% investment in equities and only 10% in fixed income funds. Reverend Amy only had 44% invested in equity funds, which makes sense since she was so close to retirement and wants to reduce excessive risk to her retirement portfolio. Reverend Larry's retirement accounts can tolerate large swings in stock market activity because of his time horizon to retirement, and he knows that life stage will continue to adjust the investment mix as he ages. By ramping up and making UMPIP contributions of 4% by 2023, Reverend Larry has effectively eliminated the gap between his retirement goal of $10,662 a month and his expected monthly income of $10,583. Of course, he has some work to do if investment returns are below average. So I've shared a lot of information with you in a very short period of time. And you might be wondering, well, what can I do? Well, here are some thoughts for your consideration. First, don't panic. We often make our worst decisions when we panic. Stock market volatility is not the new normal. It's built into its DNA. We will continue to see large swings in the market. It's hard not to get caught up in the frenzy of calamity, but remember that as a participant in a retirement plan, you are a long-term investor. You are not a day trader. Westpath's strategy to growing your retirement funds is based on a focused and disciplined approach to wealth management. Second, stay the course. We are at the beginning of this storm. Keep making contributions to your UMPIP account. And if you're not making contributions, this might be a good time to start. Your future self will thank you for your actions today. Third, contact EY Financial Services. It's a leading global financial services firm that offers confidential, objective financial counseling at no additional cost to eligible participants. EY Financial Planners do not sell investment or insurance products. This means you receive unbiased guidance without any of the sales pressure you might have with other financial planners. EY Financial Planners can help evaluate your financial situation and address your questions about retirement planning and investment management. They have specialized training in Westpath administered plans and other topics important to participants, such as the clergy housing allowance. Fourth, evaluate your cash position. We do not know how long we are going to be in the situation we find ourselves in. We do not know how severe the pandemic will ultimately be. We do not know what the economic impact will ultimately be. Do you have 3 months of living expenses without drawing on your retirement savings? Do you have 6 months set aside? Are there discretionary expenses you can set aside or reduce? Have you looked at your cable bill lately? I asked that of myself. How many subscriptions to internet content providers are you paying for? Small monthly fees eventually add up, sometimes in the hundreds of dollars. Fourth, Get your affairs in order. Have you put your important documents in one place? Does a trusted family member know where to find them? Have you discussed your end-of-life preferences with your doctor and your loved ones? Do you have a will or a living trust? We have posted on our website a link to a beneficiaries checklist, and I will show that link to you at the end of this webinar. 6, well, work longer. If you're concerned about your expected retirement income, you may have to stay employed. Let's return to Reverend Amy and see, if she needed additional income, she might be able to continue working at her church. By working 2 more years to age 67, Reverend Amy could increase her income significantly. Even if the stock market were to perform poorly over the next 4 years, she most likely would have income beyond her retirement goal. As you can see on the screen, even poor market performance would still yield around $6,300 a year, well beyond her goal of approximately $5,900 a month. My guess is that if Reverend Amy were a real person, she'd retire in 2023, just 1 year past her original target date. 7th, consider your investment actions. If Reverend Larry were to start on the road to increasing his UMPIP contributions to 10%, his retirement outlook improves dramatically. On the PowerPoint slide, you will see that he has almost eliminated the retirement gap, even in a poor market environment. Reverend Larry is thinking where he could come up with the money to support that kind of increase to his retirement accounts. Have you ever thought about the power of habits? Some habits are good, some are not so good. We all brush our teeth regularly, and we're all getting very good at washing our hands. What about our spending habits? Reverend Larry loves his coffee, and it's a special part of his day when he's able to go pick up a latte at his favorite coffee shop. He figures he spends $5 a day on average. Not really a lot of money, but he does it every day religiously. In 40 years, he will have spent close to $75,000 for that morning delight. If he invests that money into his UMPIP account, he stands to improve his account balance by about $350,000. Now, I'm not suggesting that Reverend Larry or any of us not enjoy our favorite cup of coffee, or that we only think about our future at the expense of our present. We all need to enjoy our life. But take some time during this experience of sheltering in place to evaluate how you spend your hard-earned money. Am I making good choices? Or might I rethink some of my spending habits? After all, 15,000 cups of coffee is quite a lot. We're on the home stretch here. Westpath has submitted legislation to General Conference that will fundamentally change the pension plans for United Methodist clergy. As I mentioned earlier, our current plan design has both defined benefit elements, a classic pension plan, and defined contribution elements, essentially a 403B plan. The new plan design is named Compass, and it's an account-based plan like the current defined contribution plan. Long-term sustainability and affordability are two of the biggest factors in bringing this legislation to the General Conference. The new plan also provides greater flexibility for participants, enabling them to leave a larger account balance to their heirs. It also increases the risk to Compass participants since they realize all gains and losses to their investments. It will also demand that each one of you increase your knowledge base about your retirement accounts. There are three types of employer contributions to the plan: a flat dollar contribution indexed to inflation, starting at $140 per month, a 3% contribution of plan compensation, and a dollar-for-dollar match up to 4% of plan compensation. As a comparison, the 2020 pension cost to a local church for a full-time pastor earning the conference average compensation of $75,237 is $12,228. This includes the cost of the comprehensive protection plan, our death and disability insurance plan. Under the new plan, the pension cost for a local church, and includes the CPP plan, would be $9,956, assuming that the appointed clergy person made a 4% contribution to their UMPIP account. Additional features of the plan include assistance to recent seminary graduates, automatic escalation of contributions, and better integration with Social Security income. We'll be offering another webinar on this new plan design later this year. Finally, health insurance. Pandemics and economic uncertainties set aside, healthcare insurance continues to present one of the most difficult challenges to employers. We are no exception. We have a large geographic area to cover with uneven access to healthcare in many of our less populated communities. Additionally, costs for health insurance in our conference are among the highest in the nation. We also have a high age group. Our average age is 57. Our conference provides 2 health insurance plans for use by eligible clergy and lay employees. One is a Blue Shield PPO plan that enables you to go to any healthcare provider in the United States that accepts its plans. It's also the most expensive plan we have, costing twice as much as our Kaiser plan. Our Kaiser plan is an HMO plan and is only available to participants who live in a Kaiser service area. As such, many areas of our annual conference do not have a Kaiser facility nearby. Therefore, the Kaiser insurance plan is unavailable for those constituents. As many of you know, one of the unique features of our plan design is the health reimbursement account feature that covers deductible and out-of-pocket expenses for participants. Each participant is issued a nonstop wellness Visa card that can be used to pay for healthcare expenses incurred. We established the health reimbursement account to spread the burden of deductibles and copays across our group, as opposed to a traditional high deductible plan that places those costs on specific individuals. Because of changes in health insurance plan designs, we may not be able to continue that feature beginning in 2021. We are currently negotiating with both of our providers on our 2021 policy renewals. It's too early to offer any specific information, But keep in mind that as we consider the plans for 2021, we carefully weigh the cost to you, to your local church, and to the conference. We are not anticipating a large premium increase for 2021 for Kaiser as a result of the COVID-19 pandemic. However, our 2022 renewal will most likely be impacted. That's because Kaiser is setting its 2021 rates based primarily on our 2019 experience. The status of our Blue Shield plan for 2021 is unclear. We had a significant drop in census for the plan this year. This will trigger a review by Blue Shield to determine their ongoing relationship with the conference. For over 129 years, we've been providing benefit support to the California Nevada Annual Conference. We've weathered many storms: World War I, the Spanish flu, the crash of 1929, the Great Depression, World War II, the stock market crash of 1987, the dot-com crash, September 11th, the Great Recession, and for good measure, denominational fractures and mergers. Now together, we face a pandemic and most likely another recession. Through all of this, we have remained focused on providing stable and disciplined management of the funds you have entrusted to us. Your long-term financial security is foremost in our minds and drives the decisions we make on your behalf. Questions?
All right, Paul, thank you very much. We're going to field some questions that Paul might be able to address for us. If you'll notice in the Zoom webinar interface, there's a button down at the bottom of the webinar window that says Q&A. If you click that button and type in your question there, then we can either try to answer it live. If it's really simple, an answer can be typed, but I like to answer them live. So the question, there's already one question in the queue, Paul, that you can address for us, and that is, are the pension plans that you're speaking of here, are those open to lay, or is this only to clergy persons?
So the United Methodist Personal Investment Plan is the only plan available to lay employees of the United Methodist Church. If you're a lay employee of a local church, your church can serve as a plan sponsor for United Methodist Personal Investment Plans. And all they need to do is contact my office and I can get them the paperwork for you to be enrolled.
All right.
Each church sets its own policies around how those plans or how the UMPIP plan is funded.
All right. I'm going to turn off your screen sharing real quick, if you don't mind. That way we can see your full face. We had a couple of questions that got posted in the chat. I thought I'd cover a couple of those. Most people can see them. So when you talk about years of service that people have kind of engaged with in the plan, do you include years served as a local pastor or just the years served as an elder?
Local pastor years do count.
Okay.
As long as they were an earned year, credit year, they count. So right now, for example, clergy, local pastors that are appointed half-time and above, actually all clergy appointed half-time and above, earn a credit. If you are appointed quarter-time, you do not earn a pension credit.
Okay, that's helpful, Paul. A couple of questions popped into the Q&A now. What happens if nonstop wellness goes away?
We may decide to pursue what we call a traditional plan So a traditional plan would be something like, there would be maybe $1,000 or $2,000 deductible with a $2,000 or $3,000 copay. Generally speaking, when you pay deductible expenses, they count against your copay. So that would be a more traditional plan than what we currently have. We currently have a high deductible plan, but it's got this nonstop overlay over it.
Okay, great. Good. A couple more questions have popped in. A person's asking, once I turn 65, but still working, is it better for me to stay on healthcare plan or go on Medicare? Or can I go on Medicare?
So you can go on to Medicare. When you turn 65, there are some restrictions to that. Without going into any great detail, basically you need to be at a church that only has 1 or 2 employees. We could actually go up a little bit beyond that, but we actually have to file a exemption to what's called the Medicare Secondary Payer Act rules. So there's actually some paperwork that we help prepare for you. We send it to the church completes the paperwork, sends it back to my office. We then submit that to the Center for Medicare Services that then gives us permission to enroll you into a Medicare plan. It's best to call me directly about that so that I can essentially qualify your church and you for that option.
Okay, great. Thank you. Now, another question that's popped in here is you went in depth regarding how clergy compensation for retirement is calculated. How is it calculated differently for church staff that are laypersons?
So there is no calculation for lay people because lay people are enrolled into a classic defined contribution plan, like a 401k plan or 403b plan. The compensation guidelines are there because our plans, our defined benefit plans, utilize compensation as one of the components of the formula to determine the actual benefit that they receive upon retirement. For a classic defined contribution plan, like a 401k, that feature is not present. You basically determine the amount of money you want coming out of your defined contribution account at the time of retirement. Now, let me back up a little bit. WestPath has a life stage feature, not only on the accumulation phase, in other words, while you're contributing money to your UMPIP account, but it also has a distribution component to it so that it can help manage your UMPIP account, again, which is like a 403B, or it is a 403B, or a 401k, and it can help preserve your income for your actuarial lifespan. At least that's what it attempts to do. But there's no need for a compensation number per se for laity.
All right, good. A minute ago, you mentioned something about pension credit or credit toward pension. Can you say a little bit more about what that is? Like for quarter time or full time? Tell us about how that works.
Sure. So for every, well, and this is going to be a little confusing, but there are different ways that we utilize years of service. So think of it this way: 2 people, one that is served 50% time and one that is served 100% time for 20 years, okay? Both of them serving 20 years, one at 50% time, the other at 100% time. The person who served 20 years will have earned 20 years of pension credit, all right? And the value of their pension account, will not be reduced actuarially. For folks that are 50% time, they're still going to get the 20 years of credit, but they've only been getting contributions based on 50% of their service. All right, so let's say that we've been investing $6,000 for a full-time person. That half-time person is only going to be getting $3,000.
Mhm.
So this is a very rough
Yeah.
estimate, but so that the person who served 20 years might have $120,000 plus investment returns, of course, whereas the person who served only 50% time would only have $60,000. So
Good.
now the nice thing about it though is the person who's, even if they've served 50% time, they still get 20 years counted towards retirement eligibility.
Good. Now, to say more about that, because somebody else is asking a question. And I'll give you their question because it relates to this. Is 59 and a half the age you can begin receiving benefits if you retire at that age?
So the answer is it depends. So there are three, you could say, retirement options in the Book of Discipline right now. Four, but we won't talk about involuntary retirement. There's retirement with 40 years of service or age 65. So I could serve 5 years, all right, and hit age 65 and retire without taking an actuarial reduction on any pension I might receive as a result of my 5 years of service. Okay. There's also something called the 30-year rule or age 62. So if I've served 30 years and I'm age 58, I'll even go lower, age 57, I could retire under the 30-year rule. Even though I'm not age 62, I can retire under the age the 30-year rule because I've got 30 years of service and draw on my pension. Now, when I draw on my pension, when I haven't hit age 65, I'm going to take a reduction in the value of my pension. It's actually reduced, and it's based on the number of years till I hit normal retirement age. Okay, age 65 in this case. And then finally, there's something called the 20-year rule. And at the 20-year rule, you don't get any benefits. For example, and it generally applies to people that say started in their early 20s and worked until their late 40s, early 50s and decide to retire. They don't have 30 years of service yet, but we still can retire them. They can go do something else, but they can't draw on their pension fund until they hit age 62 in that case.
Okay, good. We have time for just a couple more questions. Someone's asking, how would the proposal for Compass to the General Conference, how does that impact the amount of the pension? In other words, I think the question is really trying to get at, how does it affect the draw? Is it driven more by, because it's not an annuity necessarily, is it driven more by market conditions? Or what kind of determines the output, when you start drawing that?
Yeah, so the Compass plan is going to be a straight 403B plan. It's all UMPIP money, essentially. So when I said that basically all of the risk is now transferred to the participant. Right now, with the defined benefit plan that we have, it's the annual conference and the United Methodist Church at large that takes responsibility for making sure you receive a pension payment. If there's a drop in the stock market, and because of that drop in the stock market, we have additional liability, meaning we have to make up some money so that we can pay you the benefit. The annual conference has to come up with the money to make, you could say, everybody square, everybody whole. With a 403B plan like UMPIP, if the money goes up, that's great for you. If the money goes down, that's not so great for you, but nobody is going to be there to make up that drop. Does that make any sense?
Yeah, that's helpful. That's helpful. There's a couple more questions in the queue. Some of them are really context specific. So I'm gonna ask you to deal with the one that is just a little bit broader. And it's a question about the WestPath retirement planning tool. You mentioned something about Social Security, whether it when it gives you the amount, is it including what you would also receive from Social Security, or is it not including what you would receive from Social Security?
It is including what you receive from Social Security.
Okay, so it shows you your pension and also what you
Right.
would be getting from Social Security.
And I would say one thing about the retirement readiness tool about the Social Security estimate is I have found it sometimes somewhat inaccurate. What I would suggest for folks, and this is what I do for myself as well, is to go to Social Security system, make sure you register. All of us can do that. They've actually got some really cool tools available for you, and you can actually run your own projections. And it gives you a much more accurate number in terms of what your projected retirement benefit will be, and then you can also run the numbers. What if I wait till I'm 68 to turn on my benefit, or 69, or what if I take an early distribution at 62 or 63? It will show you that.
Okay, good. A couple more questions popped in. We got maybe just 2 more minutes before we want to shift gears. So let's see.
I see one here that asked me, what's the annuity for $331,000? That's a tough one, George, only because it varies. It depends on how old you are at the time of drawing on the annuity, but I'll give you a ballpark. In this particular case, for somebody age 63, around $1,050 a month. That's just a ballpark number.
Just off the top of your head.
Off the top of my head, I just did a quick calculation without my calculator, so don't hold me to that.
Very impressive. One also just touch real quick on the last question, really. Folks who are retired, we've heard there's a couple questions here about that in the Q&A. What impact from the pandemic do you expect on pensions and health benefits for people already retired? And then another one that's also about retirement. Would adoption of the Compass plan, does it have any effect on current retirees?
No, the Compass plan will have no impact on current retirees, existing retirees. And what impact does the pandemic have on retirees? Great question. I thought about including that in the presentation and said, well, I'll just answer it in the question period. Yes, a layperson can stop drawing without penalty at actually 59 and a half, Karen. It kind of, I hate to qualify all my responses with it depends, but if a retiree, a lot of our retirees do not have a lot of money in United Methodist Personal Investment Plan accounts, okay? Most of the retirement funds that they're receiving are in defined benefit plans like the Pre-82 plan or MPP. So in their case, they're not going to see, I'd be hard pressed to say that they're going to see any impact on their retirement distributions at all. In fact, they wouldn't. The exception is that they have UMPIP distributions that they're receiving. Well, like everybody, our UMPIP accounts have all fallen, all right, significantly. But again, since they're retired and they're in the distribution phase, they don't have as much exposure to equities unless they made a manual decision, meaning you can override life stage and put all of your money into an equity account if you want to. I'm not recommending that. That was not advice, all right? And if they did that, well, of course, they would have seen a significant drop in their UMPIP account. And as a result, it probably would impact their distributions, all right? But assuming they're letting life stage manage their account balance, they're probably not going to see a fairly significant drop there at all. Next year, what they might see at most is maybe a flatter increase, or a very minor increase as opposed to a normal increase.
Great. Paul, we want to thank you for the time today and investing in our churches and our annual conference in the way that you do. So thank you for all the ways in which you've engaged with us. We're in the chat going to give you some more virtual applause. Thank you for your great leadership for us. And Also want to turn things over to our Director of Communications as a couple of announcements to lead us out and tell us what's coming up next week. And I'll just say that it could possibly be some Director of Communications birthday today. So Selby Ewing, happy birthday to you.
Oh my goodness, I'm so outed. So Paul, what happens if you are a woman of a certain age and you have this and this and this condition? How much money should I say? I'm just joking. This was the most wonderful session that condensed so much information around such a broad spectrum of constituents. And I'm just so happy to have been a part of bringing this to our conference. And I would also just appreciate, of course, Craig and Tua, who are, part of the weekly team. And I would say that one of the reasons that you saw the PowerPoint the way you did today is because there was so much dense information. And so we wanted Paul's script to be available, and so we could track with it as we followed Paul. And I mean, I'm just in awe of Paul and all of our financial people in the conference who help us navigate these waters as we're working. So I would just add my applause to Paul and to everyone who attended. I'll say that these webinars have, really addressed a lot of technical and not so technical points within our conference, and I appreciate everyone who attends. Next week, we're going to be talking with a panel discussion about cultivating community in isolation. So you can see that some of our webinars are about very technical things. Some are about very relational things. So please tune in next week. I would also invite you to please subscribe to the Instant Connection, which will keep you up to date with all of the news that is happening. I would also say that we have added a new feature right now, and perhaps going forward, reflections from district superintendents on this season of Easter through Trinity Sunday, and Bishop Minerva Carcano will be joining in that as well. So it's always a good idea to visit our website, www.cnumc.org, and see all of the latest goings on. And I would just thank each of you for all of the unknown, I'm trying to think of the best way to say this, all of the beautiful small ways that you contribute to your communities day in and day out. I believe, and I know all of us do, that the life of the conference is rooted in the life of a local church, all of the local churches. So please, as your Director of Communications, let me hear from you. Let me know all of the things you're working on, especially in this time, and as we move into this next new reality. So, that's all I have. Craig?
Well, Selby, again, happy birthday to you. We are glad that you're able to close us out this week. We look forward to seeing all of you next week for our panel discussion. going to be a very different webinar, and it's going to be very good. I think you're going to learn some great ways to develop community in isolation next week. But until then, we'll see you soon, and God bless all that you do in the name of Jesus. Bye-bye.